and welcome to another evening of frank conversation here on Hard Copy, coming to you from our studios in Abuja. I'm Maupe Ogun Yusuf. That the Nigeria health sector is in dire straits can no longer be debated. Today, resident doctors are on strike all over the country, and some of their counterparts in the state have joined them in solidarity. The Joint Health Sector Workers Union have given the federal government an ultimatum. So also has the umbrella body for all doctors, the Nigerian Medical Association, the NMA. All of this amidst an outbreak of cholera, which has claimed over 2,000 lives in Nigeria, an ongoing global pandemic, which Nigeria is not totally free from, and a brain drain in the health sector, which has seen more of our medical army leave the country in droves for greener pastures. Many times when you speak with federal government officials, they point accusing fingers at the state and local governments as being the weak link in the health delivery value chain. Last week, health commissioners of the 36 states converged in Abuja to deal with some of the issues plaguing the health sector at their level and find ways forward. What resolutions were reached and what concretes can they deliver? Tonight, I speak with Dr. Ahmad Abdulwahab, a medical doctor and public health systems expert with over 20 years' experience in the health sector. He is currently the senior health advisor with the Nigeria Governors Forum's Secretariat. Dr. Abdulwahab, welcome to Hard Copy.
Thank you, Marco. It's a pleasure being here.
It's a pretty grim picture in our health sector. Now, I wonder if the governors are aware of how grim the picture is.
Definitely, they are aware. I mean, the intro you just gave actually shows that, yes, our health sector is in crisis, and yes, the governors are really aware. But maybe I think in terms of the context, maybe the way the federal government sees it is different from the way I think the perspective that the state will tell you.
But in the meantime, you have their ears, that's the ears of the governors. When you speak with them, from your own standpoint, what do you tell them?
The Nigerian Governors Forum, I think the forum itself is actually to promote good governance, share experience, and then promote good practices. And so every month they meet, at least even before the COVID, and during the COVID, they were meeting more regularly. And as part of the agenda of their meeting, there is a health update. So during that health update, so we present things that are happening, in the health sector, so that the governors are abreast of what is happening, and then they make decisions on those issues. Like you just mentioned cholera. The last meeting of the Governors Forum was about 2 weeks ago, and I think one of the issues that was discussed was the issue of the cholera, so that they received an update on what was happening in the country on cholera, and then they took a resolution on what they needed to do at that meeting.
Well, part of the resolutions which they took at that meeting was that they were going to intervene in the NARD strike, the ongoing NARD strike. Part of the reasons why the National Association of Resident Doctors are on strike is also because of the states. They claim that the states have not been fair in how they deal with the welfare of their members. A lot of them are owed salaries. So I was wondering what sort of intervention, because they didn't state specifically what sort of intervention they were going to have in that dispute. But perhaps you can tell us what their strategy will be.
Yeah, so what we did, we actually interfaced with the Nigerian Association of Resident Doctors, and then we asked them to list state-specific issues that they wanted the governors to address in their respective states. And they listed about 6 states where they have specific concerns. And so as a forum, the forum promised to actually facilitate that conversation between those states affected and the Association of Resident Doctors. So even at the meeting of the Commissioners of Health that we had last week, we still gave those letters. It was part of the thing that we discussed with the commissioners, and so that they'll be able to follow up. There are specific issues: issue of residency training, unpaid allowances, COVID hazard allowances. So it depends on it. Some states, okay, you have 20 months, you have 10 months, you have 6 months. So once the governors have now been very proactive to sit down one-on-one with the respective states, what do you call it, Association of Resident Doctors, so that they see that they can address it.
Well, proactivity cannot be the word for them. It is definitely reactive, because the doctors have gone on strike. And if the problems were emanating from the state, one would say that if health were a priority at the state level, the governor should have seen it before now.
So what happened, I think it's still being proactive because we reached out to National. I was the one that actually reached out to National Association of Resident Doctors on behalf of the NGF to say, okay, what were the issues? Because all the time they were speaking with
The federal government.
the federal government. They were not talking to the states. And so at the time, the chairman of Nigerian Governors Forum now said, okay, he wants to sit with them. That was about 3-4 months back. So that, okay, look, this is the first time, and the chairman told them, this was the first time you are actually having a conversation with us. Give us time to sit down and address these issues. So the actually Nigerian Governors Forum reached out. And even with this present one, I recall we had a chat with the president to say, okay, now give us all this list so that we'll be able to take it.
Well, they're still on strike, and they don't even, when they speak, they do not speak as if they consider the Nigeria Governors Forum a mediator. They haven't said anything about the forum as a whole, but when they also speak, they haven't quite mentioned that states are beginning to react in such a way that gives them hope to be able to call off this strike. I'm just looking at the fact that a number of states are owing salaries. Abia as much as 20 months, Imo 6 months, Ekiti, you know, where the chairman of the Governors Forum comes from, 6 months from what we understand. Ondo 5 months, Kaduna 2 months. These are some of the, we don't know whether a number of them have been able to defray costs now, but these are some of the things that have come up as a result of this strike. So can they really say that they're not aware that, governors in their domain were going to embark on a strike?
No, so like I said, you see, most of the conversation they're having is at the federal level. There are lots of issues with the federal government that they're dealing with. So, but now, at least on our own side, the Nigerian Governors Forum now is now discussing all this, what do you call it, these issues you mentioned. Yes, they're correct, and that's what the governors are trying to address. And I can
why I say so? Because a few states where the doctors embarked on a solidarity strike, some of the governors took exception to that, called the Association of Resident Doctors in their state and said, if you embark on this strike in solidarity when we're not owing you a dime or where we have no issues with you, we will embark on a no work, no pay. And it worked. I think that in those states, the resident doctors, maybe they did solidarity strike for a week or so and then eventually had to call it off and go back to work, because they were aware of what was happening at the federal government level. But for states, who have not been living up to expectation to say, oh, we're not aware, and it's just now we're meeting with you for the very first time, isn't that, being hypocritical or running away from the truth?
No, but when you look at it, we have 36 states. How many states did you mention? I'm not downplaying the magnitude of the problem, but when you look at it, we're talking about 36 states. You just mentioned about 6 states. I think the number of states were more than that before. I think there were a couple of states that were on the list. And I remembered, even if I can recall, Nasarawa, I think a couple of months ago, when even ARD, the last executive of the ARD, even wrote to say, okay, no, Nasarawa, they have done something. I think, was it Oyo too or so? There were a couple of states that actually were responding when the NGF intervened. Like I say, it's slow, but I can assure you that I think it's something that we are seriously, I'm a medical doctor too, and I think it's really embarrassing that we're having ourselves in this kind of situation, and I think it's something that is a priority for us to see how we address.
You were saying something about presenting the challenge as faced by the states, that the way the federal government sees it is different from how the states see it.
So you see, every time there's a problem, then they'll say, okay, it's the states that are not, that are not living up to expectation. At the meeting of the commissioners, one of the issues that the commissioners raised, one of their concerns, is sometimes when interventions or policies are designed, I think is designed at the federal level. They don't bring the states on they don't bring them on the table at the time of conceptualization and design of the policies.
Give us an instance.
So, for instance, now let me see which one now. What they were saying, even when we started the COVID, that was corrected. I mean, when we started COVID, at the initial stage when the committees were formed, there was no representative of the states. But then later on, I think after about some weeks, then the states were co-opted. And then the NGF was specifically drafted to be the one responsible for coordination. So I think that was a more recent one. But like I said, The SGF, when that was brought to the attention of the SGF, he actually addressed that issue, and then they tried to solve it. But then there are some that the story is not as bright as this one that the states have issues with.
Well, because the SGF was also at that meeting of the health commissioners, and he did say that the states or the health sector seems to be on autopilot. I do not know if that statement, was an indictment on the leadership in general in the health sector, or whether he just, because he was also the one who said that when they went around, they didn't know the decay in the health sector was as bad as they found when they made a tour during the COVID-19 outbreak. But I'm wondering, I imagine that that's also part of the home truths that, the commissioners called themselves to tell themselves. What were some of the high points for you in terms of when they face themselves to talk to themselves, things that you have been, trying to maybe pass across to the governors, which you also heard the commissioners re-echo?
Yeah, so I think what the commissioners did is just like what you are saying, that they're saying that the states are not living up to their expectation. So the commissioners came together and said, look, let's sit down with the federal MDAs and the partners and tell us what are those issues you want commissioners to deal with. What are those issues at the state level that you want us to deal with? So here we are. We want to be held accountable for all those issues. Next time when we have another meeting, we have those specific issues, you can call us out whether we have addressed it or not.
What I'm hoping to hear are some of the issues.
So some of the issues. So maybe from the perspective now of the states, I've told you about this issue of coordination. They've talked about issue of fragmentation, talk about issue of supply chain. Okay, let me tell you this interesting one: the issue of supply chain. One of the concerns that
But the vaccines?
No, generally, when you say supply
chain of what?
Medical commodities and consumables. So you find sometimes that commodities get deployed to the states, and then maybe when the commissioners don't even know that those things have been sent to the states. And so it's one of the things they said, look, even if you are sending something to even your federal institution, especially for this COVID, even if it is for our information, let's just know, so that whatever that comes into our state, we are aware of everything that comes into our state. So, and then they said, okay, how do we develop a mechanism to ensure that whenever medical commodities and consumables are supplied to the state, at least the commissioners, being the leader of the health sector in the state, must have an oversight of what is going to the states. So, regardless
of whether or not it's going, because we know that health is a concurrent matter, and that regardless of whatever policy formulation happens at the federal government level, states also have a duty to form their own policies as well. It would seem that a lot of what they're talking about is what is coming from the federal. What we get from a number of the states is that they usually have abandoned building infrastructure, taking care of their hospitals, not meeting up to expectations in places that are underserved, and that they've largely abandoned their responsibility to the federal government. That's what federal officials say.
No, when you go to a state, you have, in Nigeria now, have probably about 40,000 facilities. Out of those 40,000, how many are federal? Probably 100 or 200. Most of those facilities are the state. So we have states having specialist hospitals, we have general hospitals. So I'm not saying that the hospitals are at the level that we are, but it's not as if it's the federal government that is providing services at the state level. Yes, maybe you take a typical state where there is a federal medical center or there is a federal teaching hospital. You have that one providing those tertiary services. But majority of the facilities at general hospitals being managed and run by the states. And the states are the one funding that. So it's not as if it's the federal government going to the state providing those services. It's the state that actually man and manage those facilities. And I think one of the challenges that is recognized, at least across the health sector, is the state of our primary health care facilities. So majority of the facilities are PHC facilities. And the strategy now that is being done is to get one facility per political ward that to meet certain minimum standards.
And that is a federal project?
No. It's the state that are doing it. So there's a collaboration with the federal. And in terms of role and responsibility, I think this is where sometimes the thing gets blurry. In terms of the roles of the federal government, they are policy formulation, quality assurance, resource mobilization, providing supervision and support. While the state, if you listen to the speech of the SGF also alluded to that yes, the states are responsible for implementation. And yes, because of all these fiscal challenges and so there, but states, to the best of their ability, I'm not saying things are at the level that we're supposed to be, but you will find out that states are actually trying their best. Look at the Abuja Declaration, for instance.
Well, we'll come to the Abuja Declaration, which also deals largely with funding.
Yeah.
And we'll talk about how states are faring with that when we come back from this break. Please stay with us. Welcome back. You're watching Hard Copy, coming to you from our studios in Abuja. Dr. Ahmad Abdul Wahab, a public health systems expert and senior health advisor to the Nigeria Governors Forum, is our guest tonight. Now let's talk about funding. The Abuja Declaration says that 15% of the budget should be what is dedicated to health. But we know that the federal government, at least in the budget that it allocates to the Ministry of Health and under the headline of health, has oftentimes fallen far short of that. And it's oftentimes some of the protest points for the health associations in the country. Sometimes it goes as low as 6%, or we are doing between 4 to 6% roughly. Yeah. I do not know first if you have an aggregate of what the states are spending. Maybe the states are doing far better than the federal government in what they allocate to health.
Absolutely, the states are doing far more in terms of allocation. I think the best the federal government has ever gone is 6 or 7%. That's the highest. You have states that have 12, 13, 15. So you have states. So honestly, in terms of allocation,
but on aggregate, if you were to do an average of what the states, I know that it's not be fair to lump states that are doing okay, and a few states are doing their best, but some are simply not pulling their weight.
It's absolutely, the average is higher than that. I think the average will be talking about 9-10%. If you pull the whole state together, you'll be talking about 9-10%, which is much higher than the state. But to be fair, I think it's not about even the allocation alone. I mean, the proportion that's allocated to health, what is it used for? I think that is what the narrative that we're trying to push in the health, trying to put the money where our problems is. So I think it's allocative efficiency. That is what we are trying to ensure that is what is practiced around the state. Yeah.
So in terms of targeting the areas of deficiencies, the areas that make us vulnerable and keep affecting our health indices, I mean, when you look at it, 100,000 live births and 900 women are dying out of that. 1,000 live births, 58 newborns die before their first birthdays. These are not palatable figures. So what areas specifically would you say that, you know, states need to dedicate their resources to if we're to reverse the trend in terms of these figures?
So what we have done at Nigerian Governors Forum, so we have what we call the health priority areas. I mean, the areas. Of course, you have universal health coverage. And the whole principle of universal health coverage is people having access to the quality health services they need without financial embarrassment. So there should be a component of financial protection. And this service should be equitably distributed across the state. So it's one of the priorities that the Nigerian Governors Forum is pushing. 2, nutrition is a very important issue. When you mention all these mortalities of children, underlining all the deaths of children, almost 52% or so, you'll have a nutrition issue underlining those deaths. Then we're also looking at routine immunization. Although you see, the Governors Forum was very active in actually polio eradication. Yes, polio has been eradicated, but we'll still have to continue to strengthen our routine immunizations.
Yeah, because we just had a case of an outbreak of environmental polio.
Yeah, so what's called all those, we call them circulating vaccine-derived polio. So, and then what we need to avoid those is, there are lots of discussions around it, but the key thing is we want to strengthen our routine immunization so that people are protected. And then the 4th area of recent is all this COVID that we're having, I think we're looking at it more holistically, talking about health security.
Speak to this issue of cholera. It is untenable when you think of it, the fact that we've lost 2,000 people, and every year it's almost like, excuse me, Lassa fever. We hear an outbreak of Lassa fever. We already expect it. When the dry season comes now, we know that we're going to have an outbreak of Lassa fever. Maybe something will change next year. We don't know. We hope that something positive happens. Yeah. But it will seem like almost every year we can predict when we will have a certain outbreak. What concerted efforts have gone into stemming outbreaks that we can predict and outbreaks that are totally avoidable, like cholera?
Honestly, it's a shame to say at this age now we're still having outbreaks such as cholera. But what we need to do is, for our health security, you have to look at it not piecemeal. Have a very strong surveillance system that when you start having cases of vomiting and diarrhea, it will be able to pick it up. You have a very strong laboratory network that will be able to detect and see, yes, this diarrhea and vomiting is not just gastroenteritis, it's actually cholera. So they'll be able to detect it very well. And then you have a team on ground that are able to respond immediately, and you have the finances. So having this holistic approach, that you have very strong EPID units in each of the states. So in each of the states, there's what you call the epidemiological unit. So strengthening those epidemiological units and strengthening all those health security capacities for them to be able to respond to not just cholera, but just epidemics in general.
I'm wondering whether the governors will be listening to you right now when you see that politics is already warming up as we get to 2023. How difficult or how easy is it to get their listening ear at this point?
But you can't go and be campaigning when your people are dying. They're listening. If I said it was one of the agenda that was discussed on the, what do you call it, at the last NGF meeting. You can't just, they can't fold their arms and see their people dying and say they're going to be campaigning. They just have to have a way of balancing that. But anyway, I'm not a politician, so what I think, for me, I talk about the health issues and try to advise on what they need to do.
Yeah, I'm wondering, because sometimes you've talked about how they need to strengthen the epidemiological units, but then there's also water, portable water, which is at the heart of this. Is it something that is also being considered, that if they're able to provide, meet certain goals, for instance, that we should be able to get portable water to all of our citizens in the how many local governments that they are in our state, 774 of them, nationwide. How difficult a goal is that?
That's now you're talking about the Ministry of Water Resources working closely with health. So, and then you also talk of Ministry of Environment and talking about sanitation and all those issues. So we have to work together, not just health. It's not just a health issue. It's a multi-sectoral issue that all the different ministries have to come together to be able to address it.
How do you take on board peculiar cases? You have served in Yobe State as a director in the health services sector. Yobe, has witnessed insurgency, as is Borno currently witnessing it, and Adamawa, which is also going through the pangs as well. Now, how do you take into cognizance these peculiarities when you're coming up with advice for the governors?
What we try to do even at the state level is we have this different state-specific best practices that we try to collate and try to actually share with others so that they can also learn from it.
But in terms of concrete from that meeting, what do you think was reached that you think fundamentally could, help turn back the time, or like say, reverse the negatives that we have seen in the health sector?
For me, I think one very strong resolution is on the health insurance, because reasons why people don't access care sometimes, finance is a huge factor. And so one of the things is saying, okay, wants to make, although the talk has been happening, but at least they affirm it, that health insurance should be mandatory for each and every citizen. If the health insurance is working very well in all the states, then people can just walk into a facility and they'll be able to access care without paying at that point when they're accessing.
Well, when they know that that will be when the health facilities are working and their personnel there to attend to them.
We'll start somewhere. And I think, so it goes, apart from, what do you call it, it's not just saying we want to start health insurance. One of the things that is very critical is the facilities have to be, what do you call it, to certain minimum standard for them to be able to provide service. And then one other thing that I got from that meeting is the role of the private sector, which is something that I think we have not been tapping very much. And the SGF alluded to that in his speech, that even for the COVID response, the role of the private sector in terms of how they help in the response. And I think generally beyond the COVID response, when you look at the health sector in general, I think there's a lot of things that we could tap. I don't want to mention the name of private sector, but at least we got some private sector that were at that meeting, and some of the promises that they made are something that we are going to follow up. For instance, we have a private sector that is saying, look, we can help you design a supply chain system. You don't have to bring money, but we're going to design in such a way that it is going to be self-sustaining. And so we're going to explore those offers that we had from private sector. And I hope that those things are going to help us in that.
Dr. Ahmad Abdul Wahab, thank you for coming on Hard Copy.
Thank you.
Well, that's the program tonight. We want to hear from you. As always, please email us using the handles on your screen. Thank you for watching. I'm Maokwe Ogun Yusuf. Good night.